Great evening, guys. Thanks to Indian Medical Association and its team for this wonderful opportunity. And thanks to Dr. Venkatesh and Dr. Parthiban for organizing this event. And it's been a great pleasure to be here. Myself, Dr. Sathish Kumar Anandan, consultant surgical oncology in Apollo Medics Super Specialty Hospital, Lucknow. And topic for today's discussion is around surgery, a career option after MBBS. So that's what we're going to discuss. So it'll be a very short and precise session. I hope it doesn't go beyond the 30 minutes maximum. So let's dive in. The quote says, surgery is a lifestyle, guys. It's more than a degree. So that's what we're going to discuss in the upcoming slides. Parthiban already gave a small intro about myself, where I did my undergraduation and post-graduation and my super specialty. So my expertise in various cancers includes breast, oral cavity, stomach, colorectal, gallbladder, gynecological and genitourinary cancers. And with a special interest in advanced stage cancers, and we perform good number of advanced surgeries, including cytoreduction and HIPEC procedures. And we offer a good amount of fertility preserving procedures to the patients as well. So with that, we go to the topic proper. What we are going to discuss, guys, today, like whether to take surgery or not is the point of discussion. So whenever we complete our internship or doing during our MBBS periods, like we always have this thought, those are 50% of people are very clear. They want to take surgery. So there is no ifs and buts for them. But there are remaining 50% of students like us, they like surgery, but they are more worried about the field and the physical and mental need from them, and whether their character and personality able to suit that or not. So for those 50%, whether in doubt to take the surgery or not, the whole session is for them. So this is what the outline we are going to discuss, guys. Why surgery despite of all its struggles? What is the scope in India and abroad? Is it an end branch? What about the female friendly nature? Is it recent oriented? Where to take south or north? The main aspect, financial aspect, how much we earn as a surgeon here, and whether to take DNB or MS, or where go for a 6 years course or in 3+3 years course, or just a 3 years course sufficient for us, which college. So this is a brief outline what we are going to discuss. This purely going to be a practical oriented session, like it's not going to tell what are the indications, why you want to take surgery. This is a complete practical questions, and the slides are made based on the interview with the interns which I found here. So it'll be a practical session, guys. So make use of it. So exactly, why surgery? Despite its long working hour, and it's like completely a physically and mentally exhaustive field, and I can't say it's can't practice independently, but it's quite difficult to practice independently in the early period of your career. Yeah, these are the hurdles which everyone puts in front of us whenever we discuss. No, guys, I just want to take surgery. These are the hurdles which come in front of us. I will tell you one thing, guys. Uh, the surgeons or those who want to take surgery usually got a very simple thought process. I just narrate a small story. Whenever I discuss with my medical colleagues, right? So they always have this concept of assuming things and getting treated. I used to talk with my guys from PGA and AIMS Delhi. So they have this kind of thought process that they assume that this patient is having this problem, and I'm going to give this drug. This drug is going to act on this receptor. This ion will get released, and the patient will get cured. So when they give the drug, it acts and the patient gets cured, right? They will have this dopamine release here. Wow, what happened, man? What we saved the patient. But my thought process or the surgeon thought process is very clear that we don't want to complicate things like that. So we have very simple thought process, like if it is there, it is there. If it's not there, it's not there. That's it, man. If it is there, we want to operate the patient. If you think the patient is an acute abdomen patient, and a straightforward, you just open and see, open and see. If you don't want to open and see, just do a conservative management. So surgeons or the persons who opt surgery or those who having a very simple thought process. They don't want to complicate things, and they don't want to beat around the bush kind of guys. So if your thought process are like, no man, I just want to have a simple thought process and lifestyle, you can definitely opt for surgery. And will have clarity in thought process, and you don't beat around the bush. If it is there, it is there. If it is not, it is not. As simple as that. You live a very simple and clarity life. And yes, guys, there will be a progressive personality in a surgery. So everyone got their own personality when they enter any field, right? But the personality will be very progressive. Progressive means in professional life, in personal life, you will get more ahead in every point of life, because continuous learning and progression is incultivated in our residency program. So whether knowingly or unknowingly, you learn this habit of continuous progression. So that will make your personality a progressive personality, guys. And respect plus swag. Being a medico, you will definitely get respect. Right now, the trend is changing with a totally different story, but the respect plus swag comes only in surgical field. Whether you take an MS general surgery or any other field, the surgical field gives you the swag, guys. So these are a few aspects. Still, the guys are girls are taking surgical field mostly because of these few factors which fascinates them. But in this session, we are going to see much more than this, which makes you to take, or which you're looking for. So, what is the scope of surgery in India and abroad? It's an evolving branch, and we are completely evolved from open to laparoscopic to robotic, and obviously through natural orifice surgeries as well. It's an evergreen and ever evolving branch. No one will question about it. So, the arena to choose is very huge, guys. If you enter the surgical field and if you feel this hardcore general surgery is not suiting you, you want to go for something cosmetic, something lighter, you have an option to change. The arena to choose is huge here. So that makes the whole field plausible and flexible. So that's one of the very important thing in surgery you can see. And job opportunities are huge, especially in tier 2 and tier 3 cities more than tier 1. Yes, of course, in tier 1 cities you got a good job opportunities, there's no doubt on that. But due to the super specialty trend, and the opportunities for in tier 1 cities are quite competitive when compared to tier 2 and tier 3 cities. We'll completely discuss about this super specialty trend and job opportunities tier 1 in the upcoming slides. Job options definitely you'll get in institutes, you'll have in medical colleges, you have in corporate hospitals, private hospitals, and you have in great companies of Tata and all those companies, where you will get in a well qualified job, well paid, and no hectic schedule like we assume in a general surgery period. So the job opportunities are cool and good here in general surgery. You can choose whichever you want according to your need. So there's a small gist about what the scope of surgery is. It's an everlasting branch. There's no doubt in that. The main question comes is, sir, is it an end branch, or do I need to do anything more than that? So you can't give a straightforward answer. If you want me a straightforward answer, I'll say at this point of time, definitely not. The trend is towards super specialty and so on, guys. There is no doubt in that. But there is a definitely or large vacant space for general surgeons. If you want to practice only with general surgery, definitely you can, because the general surgery patient base is very, very huge right now, which is a very vacant area which we often miss to identify. And I always see that the students who take general surgery or fail to understand why they want to do a super specialty. They just go run behind the super specialty of any course like surgical oncology or medical GI oncology or urology, any upcoming field. Just go and go behind that and crack the exams, and they want to take it. Please don't be like that, guys. My sincere and humble request is like, just compete your general surgery, see what is happening, what you want to do in next 5 to 10 years period of time. If you're interested in some field, look out. If that field got in any fellowships, just go for it. If the field got an MCH, just go for it. Be precise what you want to do. Just don't blindly go behind the super specialty, because it's kind of a time consuming and economic consuming and a mentally exhaustive field. So you have to be very precise what you want to do exactly. If you're very clear, then you have an motto to go for it. So my humble request will be, if your interest of area is it available in super specialty, then go for it. Never blindly go for super specialties, because that will fetch you in nothing. So this is a very old concept. Is it female friendly or not? I don't want to put this slide actually, but this kind of topics will used to go around 10-20 years before. But right now it's completely a female friendly field. And even in my own batch, we got out of 12, we got 4 to 5 female PGs doing in our subsidiary hospital. So it's a completely female friendly. There is no discrimination in surgery. especially in MS general surgery, and there's no different gender differentiation. And if girls or females think that say it's a very physically strenuous job, you'll definitely get help there. You'll definitely help. So, like any turning the patient or dressing obese patients, your friends are there, they will definitely help you. So, don't avoid this subject or topic just because it takes some kind of a physical strenuous activities. So, their helping hand is always there, and don't worry about that. And the next main topic which comes is for girls or female especially is planning pregnancy. Will I able to plan pregnancy in like in my residency period, especially in my MS general surgery period? What about my menstrual health? Will it get affected because of this hectic schedule? Uh, Girls, like this is not this is so absurd, girls. Like menstrual health is maintained like any other branches in medical aspect. So don't worry about that. It will be normal. And regarding planning pregnancy, and most of my friends plan pregnancy in the second year of residency or the initial part of third year of residency. So the personal life also you can have along with this professional life. So don't worry about all these things. So you can have a good family life as well as a menstrual health and as well as a personal life in the MS dental surgery field. The next big question I get from my colleagues or juniors is like, sir, my parents, I'm being a girl, my parents hesitate to send me to other states. So how can I convince them? Like, so what are the things? Is it safer to go there? So girls, like the support system is very good right now. The environment is safe everywhere. So don't hesitate to go to new places just because you're doing a gender surgery, just because you are a female. So don't have this kind of thoughts. Just go to that area. If you feel that area provides you a good academic and surgical exposure, the support system will take care of you. The environment is much, much safer right now. So come out of your state, you will get good number of your local friends in that new state or new city. So I can vouch for it because being a guy from Chennai, moved to Delhi and moved to Patna, it's kind of a quite a decision for me. So, but once I enter the city or the state, the number of local people you'll get from in that new city is huge. So you'll never feel left out. So even it is same for girls as well. You'll get good number of girl PGs and colleagues there. So no need to worry about that. In fact, certain surgical specialties are overloaded with female colleagues. So please go for it. Don't see these are the hurdles which are kept in front of you. And girls are blessed with finer skills. So surgical field will definitely match you. So please enter it. And it's already going on. I don't need to repeat it again and again. And is it a research oriented branch being an MS center surgery? See, surgical field is an evolving and a research oriented field. It's up to your choice, guys. Like if you're academically oriented and there's a good scope in terms of OT, that is operation theater teaching and other ward teaching and other teaching opportunities. So if you're artistic enough, you can bring more nuances in the field. It's up to you. Whether you want to completely dive into research, yes, you can do it. Or if you want to dive completely into clinical, you can do it. It's up to you, guys. This is a topic like north or south. Like I'm from a southern part of the nation. So is it possible I can take a seat in northern or from north to south? So basically, guys, it does not matter. It does not matter. So whether you're from south or north, choose the college of your interest. That is what matters the most. Be clear. Have a clarity thought. Is the college is good? Are they providing good academic and hands-on session for the students? What are their passed out students are doing right now? Are they placed in a super specialty? If they are doing emergency, how their exposure, how their clinical equipment. So if it is good, definitely go for it. If it is far away from your home, no worries, just go for it because all other things will take care of it. The currently the world is getting smaller and smaller, so don't restrict yourself. The main struggle or hurdle we feel when we call about north or south is like so the language is totally different here and the culture and the food habits, everything is different. how am I able to cope up with this? Well, I'm quite confused. So language, if it is totally new, you can learn within a period of 3 months. That too in a surgical field where there's a constant touch with the patient and patient attenders. To be frank, my knowledge regarding Hindi is very minimal before going to Delhi. So I did my schooling, undergraduate, everything from Chennai. So the moment I went to Delhi, it's completely new to me. The culture and the attitude, the language, the food item, everything is different. But it only takes a matter of months to cope up with this. So don't worry about it. I'll just brief a small story. Myself and my friend, we are both from Chennai. So we are seeing patients, and that's our initial period of our residency. So we are seeing patients, and we are just learning Hindi at that point of time. So there are certain spelling mistakes and the pronunciation mistakes we used to do, right? In Hindi, that's Umar is called as age, and Kamar is called as hip size. I think Kamar is hip. So my colleague asked there's a 25-year-old female sitting with father, and we are about to take in history of the particular patient in the ward. So she's posted for tomorrow's OT. We are writing the case history. So my colleague asked, instead of asking what is your age, that is what is your umar, he asked what is your kamar. Okay, so all the staff nurse, everything got bewildered and what happening there. And she told me sir, kamar is hip size, and we got annoyed. Oh man, she's a 25-year-old female, and she's sitting with her father, and how this guy will take it. But guys, you know what? Her father sitting in front of in with her told us uh, guys, I'm so happy that you came a long way here and trying to learn our language and treat our patients. This is a very huge thing. So I don't mean anything wrong about that. You will learn as early as possible. So which gave us a boost that the local people of that particular land will take care of you. They know that you are new to that particular place. Whether you're from north to south or south to north, don't worry. The local people will see you how much of time you are investing as a general surgeon. So they will always take care of you. They will, more than they'll tell, they will protect you. In fact, there are so many situations where the local people in that particular area protected me from getting any kind of issues. So being a dedicated person, being a dedicated general surgeon will always fetch you more, guys. So don't worry about this north or south kind of political issues, all those things. So different culture, accept and cherish the new one. There's no discrimination, no favoritism. So you can definitely opt for a North Indian college if you're from South, or South Indian college if you're from North. There's no difference in that. The only expected thing is, are you dedicated to this field? That is what matters. If you're dedicated to your field, if you're dedicated to the patients there, you will definitely be taken care of. So coming to the hot topic of the day, what is the financial aspect of a surgeon, sir? Like how much he can earn. See, during the post graduation, the pay depends on that particular college, guys. If you take a state college, the pay scale will be different. If you take an institute, the pay scale will be quite higher when compared to the state colleges. So it depends on the particular college where you are pursuing your post graduation. But once after completion, your pay scale will lie around 1 to 1.2 lakhs, depends on the area. So this is almost like a average amount. Along with that, you can have your own private practice, which can fetch you around 1.5 to 2 at a minimum lower scale. So this is the base level after completing your MS general surgery. So if you go to second tier cities, definitely pay will be more, because the calculation is demand supply. Where there's a more demand, that then you will get paid more. So the financial aspect grows exponentially with experience, guys. So don't worry about the initial life. You will experience and you will earn a lot. After super specialty, definitely there's a boost in salary, which I can vouch it will be a 3 or 4 times more than your surgery salary. So don't worry about the financial aspect. Initial time you have any doubts, you will question yourself whether you're doing a good job or not, because you are from a financially uh, not that kind of a background, but you are investing so much amount of years in surgery, especially in MS general surgery for 3 years and MCH in 3 years, whether my financial will be taken care of at the end of this course. It will definitely, guys. So don't worry about it. So the main topics like what is like, is it MS or a DNB? If you ask me the same question a few years before, my answer would have been totally different. Right now, both are equal. There is no difference, guys, when comparing to MS general surgery or DNB general surgery. So you can opt for any, whichever possible. So there are few subjective opinions from my side. So I just call it subjective because it changes from person to person. So I feel the hands-on are more in MS surgery when compared to DNB, because DNB courses are usually done in corporate or private setups. So that is one point I always want to tell. But assess the place. If you're able to get a DNB in a reputed institute, it is always better than getting an MS in a remote college where you have no idea how the academics, how the hands-on, whether you are taught by people who are like completely exposed. So always choose this. I always prefer getting a DNB in a reputed institute than getting an MS in a very remote colleges where you have no idea how the department, how the system functions there. So government MS is obviously a more than a private college. So because the private colleges have fee structures are very high, but in DNB the fee structures are capped. If you're going to do a DNB general surgery, so the fee structure I think around 1.2 lakhs per annum, and you get a good amount of stipend based on the state medical colleges. So always look for bond and financial aspects as well while choosing this course. I will tell about this bond and financial aspects in the upcoming slides, because currently all the students, especially the MBBS students and interns, are have a very clarity of thought regarding this bond and financial aspect. We'll discuss that in the upcoming slides. So there's another subjective opinion like this. I always feel like DNB residents are much read than MS resident, because the DNB program is more of an academically oriented. Of course, it doesn't mean they don't have any kind of surgical skill. The surgical exposure are also good. When comparing to MS, the DNB surgical residents have a great exposure to the super specialty courses, which I often see even in current institute. I always feel that DNB residents in Apollo Lucknow are having a great exposure to super specialty departments. So, so there are a few pros and cons of MS and DNB. So my final take will be both are good. So you won't regret if you take any of this. So again, a very important question. So why you want to crack my head by taking an 3 years MS and then thinking whether to take an MCH or not? And if you want to take an MCH, I have to put another some amount of time and energy to get an course of my choice. Why can't I take a general the straight 6 years course? That will be a cakewalk, right? Because there's only one exam. I clear that exam. I taken a course of my choice in 6 years. Then that's it. For 6 years, I'll be there, and as I come out, I'll come out as a super specialist. Won't that suffice for me, guys? You are right. You are right in a certain way, actually. So in India, we have a 6 years course for a neurosurgery, pediatric surgery, plastics. If I'm not, I think CTVS also provides a 6 years course. Yes, of course, it provides a better training, 6 years at a stretch. There are few, I don't take disadvantages. There are few points you should think before taking this 6 years course. Like, you can't change in the midway, because those who are taking this 6 years course are MBBS students. Their exposure in super special departments are very, very minimal during our internship. Right? We have no idea how the super special department works. I have no idea. While doing my internship in a Chengalpet Medical College, I have no idea how the plastic department runs. Even though we have a dedicated plastic department there, because we are not posted there, and we are not posted in the neurosurgery department either. So you can't change in the midway. Our exposure as an MBBS student for this super specialty course is very less. So if you take any course because of your fascination or because of your motivation, at the end of 3 to 4 months itself, you start regretting it, guys. So that is a very, very important thing, because once you leave the course, there's no comeback actually. So that's a problem in 6 years course. Because if you've taken a DNB seat and you left it, I think you can't write it for a good number of years. I'm not very sure it's 3 or 4 years, but you can't write the DNB course for a good number of years once you left the seat. So can't change in the midway. That's one of the very important disadvantage in 6 years course. And the general surgery exposure is less. Yes, that is that. You see, all the proponents of 6 years ago used to tell we have a general surgery course that runs for 1 or 2 years. We do work like an residence of general surgery. Yes, I know the 6 years course also offers a general surgery exposure, but how much it is taken by the residents, importantly, that matters. Because I have seen few of my 6 years residents, they are taking this general surgery exposures very lightly. They think that no, my exposure is neurosurgery, man. Why the heck I want to do this kind of dressings, all those stuff? I don't want to do that, guys. The general surgery is the base for everything, not only for surgical oncology, GA surgery, or urology, even for neurosurgery, plastic, pediatric surgery, patient assessment, pre-op management, post-op management, wound care. All these are a basic line on which the super specialty foundation are laid. So if you start assuming general surgery is nothing, definitely your foundation we won't be that much strong. So that's the main reason there's a high drop rate, because you can't change the field. So what can we do? So like you have told everything about this. So what's a final take-home message? Whether should I take this or not? 6 years course after completing my MBBS. My humble request will be like, you assess the field, guys. If you're 200% sure that this is the field you want to do it for your lifetime, then take it. But 90% of us will not have this kind of confidence to take that particular step. So what we should do then? Just do an observership in that particular field for 2 months. Just to go to a nearby neurosurgery department, ask him, so I just want to observe what is happening here. I'll be here for next 1 or 2 months. Let me see how the department runs. Because going for 1 or 2 days not going to change anything. Just be there at least for 2 months. Just see how the patient get admitted, gets operated, post-op, recovery, complications, how it happens, how the timeline for them. So if you observe all these things, you will get a good idea whether you can take this course for 6 years at a stretch, because that will give you a better idea whether you are capable, your personality suits this 6 year super specialty course or not. So that's my take home on this. So Sally, you're confused of so much. There are so many options like MS, MCH, fellowships after completing that. My financials are not that good. After completing my MS general surgery, will I able to thrive with that, or MCH is necessary for it? So guys, the answer depends on where you want to practice, which are tier 1, tier 2, tier 3 cities. There is no doubt the MCH overshadows right now. The trend is towards super specialty, but most of the areas are right now a gray zone, guys. The concepts are gradually changing. My personal request will be, after completing your MCH, even during your MCH, you will be posted in your super specialty departments. Just see which fascinates you, which you want to acquire. Or after completing, you think about yourself, what you want to do in next 5 or 10 years life, where you can see escalation and progress. And if you feel that particular subject offers an MCH, just go for it. If that particular field offers a fellowship, you can definitely go for it. There is no doubt in that. But as I said previously, don't run behind the fellowships or MCH blindly because your colleague is doing that. Because in that way, you are going to spend totally a 12 or 13 years of life, starting from MBBS till completing your MCH, with all kind of ups and downs in the financial, emotional, and social aspects. So just running behind any kind of a super specialty course will never going to fetch anything. You will end up in spoiling both your personal life as well as your personal life. At the end of, you'll say that I would have not done this, I would have done that. So completing MCMS is more than sufficient to thrive at this point of time, provided where you want to settle. And if your clear intent is that I just want to take an MCH course and my subject of interest is this, and this provides an MCH, please go for it, guys. There is no doubt. But general surgeon got a huge patient boost. They can have a huge patient practice with that as itself. There's no doubt in that. The government institutes are private, so everyone will get a clear-cut idea that obviously any students who are opting for a general surgery will definitely take in a government or institutes, and obviously private is not anything we should definitely avoid. So the days are changing. There's a very beautiful story, guys. Not a story, there's a kind of experience which I had a few months before in AIMS Patna with one of my colleagues there. So back then, like in 6 or 7 years before, while myself and my colleagues are taking a seat for general surgery. So the only thought process we had is like we want to take in a state government medical college for MS general surgery. That's it, because the hands-on will be good there, and the exposure will be great there. So that's the reason. We don't want to prefer any institutes like All India Institute of Medical Sciences or PGH Chandigarh or Jipmer, because all the institutes, the surgical hands-on will be less. This was taught to us like it was quite true as well. When comparing to state medical colleges, the institute provide less hands-on. There's no doubt on that. So this was our intention, and everyone who gets a good rank through AUPG or NEET goes to prefer a college of state, the state medical colleges or other state-based medical colleges. That's what our intention was. We had very clarity of thought. But right now, the MBBS students, interns, or the PG aspirants have a very clarity of thought that, sir, so I know that times are changing right now. I know after completing my MS general surgery, I have an option that 50% there's a chance that I have to do my MCH. So keeping in that mind, so there are few variables I want to see before selecting a college. I asked, what are the variables, guys? You just tell me that. So he told me like, so I want a good pay, because that matters in at this point of time. So the pay, it takes care of my family and myself, so that I can have this long run, because it's not a sprint race where you can just run and take a nap. It's a kind of a marathon. So I just want a good pace. So I don't want any bond. I was like fascinated. Oh, great. Because like a bond also constrains yourself by doing any kind of super specialty or any fellowships per se. So I don't want any bonds. And I want a good work-life balance with an appropriate surgical exposure. So I don't want to do at least a 10 to 12 emergency laparotomies in a day. If it is 4 to 5, I'm happy with that. But I want a good work-life balance. So these three things I always calculate, and I always want to take an area where there is no bond and pace is good and the surgical exposure is adequate. It's not necessary, it has to be very hectic and mentally exhausting. If it is adequate, at least in the first year, I will put all my effort. In the second year, I'll get free time. In third year, I'll get a more time for academics. And at the same time, I can prepare for my MCH as well. So I was fascinated by this guy's talk, and like, what kind of clarity of thought right now the MBBS students and the interns are having and the PG aspirants are having right now. Initially, I thought this guy is doing a stupidity, because by getting a good rank, he would have taken a best state medical colleges. Then after listening to his talk, I was like, he made a calculated decision, which is in a very educated. So I was like, so happy for him. Like, so right now, the guys or girls are very calculated. They know what they are going for. So taking government or institute, it's up to you guys. So both are good. You just take a calculated decisions which you want to practice. So that will give you good results. So this is completely subjective thought. Good if it is from government more than private, and no need to worry, guys. Suppose if you are doing it from a private medical colleges, no need to worry. If it everything will get neutralized at MCH level. So government or private or institute, what matters the most is the mentors. In surgery, everything depends on the mentors. So if the mentors are good, you will definitely have a great surgical exposure. So the same thing, like which college to prefer, a state or primary institute or private, this shuffles and goes on. The subject Calicut, SMS Jaipur, UCMS. So it's totally subjective. You decide among yourself what you want to do, a state government medical college or a primary institutes. So take a calculated decision, and both are equally good. One provides a good hands-on exposure, another provides a good hands-on exposure and the other allied features. So both are equally good, doctors. So like it's a totally exhaustive, and I had taken almost like 30 minutes. I think we'll wind it up soon. So onnume purile, doctor. Like this is a very long session, and how to take a decision. So guys, like these are the few boxes which I want you to take, whether you choose any colleges for any course. What is the location? What is the stipend? What is the bond? What is the hands-on? What is academics there? And what the past residents are doing right now. So you just assess all these 5 boxes and tick all these boxes. So it is not possible for you to tick each and every box for a single college. You might miss some, you might have few. So whichever feels the most, just go for it. That will be a better option, because always there's a positives and downs in taking a college. There are few colleges that are better in good something, won't be better in some other things. So if there's a good hands-on exposure, you may not have a good work-life balance. If there's a good work-life balance, your hands-on exposure will be very much lesser. So you have to take a calculated decision according to that. But make sure these five boxes are ticked as much as possible before taking any college for the choice. The final few slides are the pros and cons of taking surgery. So everyone will tell that it is a mentally exhaustive and physically exhaustive field. It takes time to rearrange your lifestyle. It's a very long learning curve. It totally depends on your mentors. At times, it put pressures because if you're sole breadwinner, especially due to financials and surgeon stress. So surgeon stress is nothing but in surgical life, it is very difficult to differentiate your personal and professional life, because like if I operated a case today, if I come home in the night, so even I'm sleeping, I used to think about, I have done this will it leak? I have done this kind of anastomosis. Will it be okay or will it leak? So this kind of thought process inevitably goes in the surgeon's mind. Suppose everything goes good for the patients, I'll start thinking about the next day patients. Okay, I'm posted this patient for tomorrow. Will it be uh, eligible? Like, will it be fit for anesthesia? Everything good for the patient. So this kind of small stress will definitely be there for surgeon's life. So that is quite inevitable, which I had in the initial period of my career. So what are the main positives or pros about taking a general surgery? It is philosophically, it's a lifestyle than a profession, guys. Like we discussed earlier, it teaches you live at the moment. As I said earlier, like surgeon stress. The surgeon stress I discussed with my senior and colleagues. I told that, sir, like it's eating my personal space even after completing my residency program. Then he taught me one thing: Satish, surgeons are the persons who live at the moment, man. So if you think about this for your whole lifetime, you can't have your own life. So whenever you complete a surgery, doing any surgeries, invest your 100 or 200% in that particular time. You check intraoperatively whatever you want to do. You want to take another suture, take another suture. You want to place a drain, do everything intraoperatively. But you close the abdomen, you come out, don't think about it. You just completely forgot it. So just start living at the moment, because this kind of words will encourage me a lot, because then I started assuming this live at the moment, change my thought process and give a clarity about how we can lead our life. Not only in surgery, guys, even in life, we have to live at the moment. Because if you are not able to live at the moment, right, you will have more kind of struggles and hurdles, and the mental fatigue happens for you. So this surgical career also teaches you how to live at the moment, because unless you expose to something struggles, you can't learn this just by reading or listening to some kind of motivational talks. So this living at the moment, I learned after going to the surgical field. And financially, it depends on where you work. If primary institute, you're heavily taken care of both academically and your financial growth, and n number of perks are there in primary institute like AIMS and PGH and bigger. If a private practice, there's the initial lag phase. So get attached to some fixed income hospital, then explore during your initial period after completing your MS general surgery, guys. The financial after MS general surgery will definitely improve exponentially with your experience. So don't worry about that. Academically, always remember, things will be there to learn and to teach. It's a good branch for those who are interested in teaching students. There'll be instant gratification, and it's a more creative and artistic field. And finally, surgeons are born, not made. This is an absurd statement, guys. We are born as a children, grown as an adults, we die as an experienced people. So no one is born as a surgeon and die as a surgeon. So with a constant practice, patience, and perseverance, you can also become a great surgeon one day. So just practice, have a patience, have a perseverance. That will definitely fetch you whatever you want. The final take-home message: invest for MBBS students, invest in internship, because that will give you a brief idea which field you want to choose. Because right now I'm seeing all the interns like equally spending good amount of time for preparing for their postgraduate. That is good. That is equally good. but invest your time in internship as well, because skipping the internship, just preparing for a coveted branch will not get any, will not be suffice for your long-term journey. So equally invest in internship as well as prepare for your PG as per examination. That will give you a great leap for you. Take the surgical branch with a complete belief and positive motivation. Endurance is the key. Trust yourself as a surgeon. Move ahead. You will definitely shine. And remember, guys, the day you enter being a surgeon in OT and everyone is waiting for you, a person will come and put your surgeon's apron and you step into the patient. And the moment you ask, scalpel, please, a great dopamine kick will you get, guys. You will never forget in a whole lifetime. So, welcome to the field of surgery and thanks a lot. And any further queries, you can message me through my Insta ID. And this is my journey. Just trust the process. You will never regret. Thank you. Thank you, guys. Over to you, Dr. Parthiban.
Thank you so much, sir. That was a wonderful and elaborate session. Now, participants, if you have any queries, please post it in the group, the chat box. And personally, I have a few questions.
Sure. Shall I stop sharing the screen here? Is
okay,
it okay?
Yes, sir. Yes, sir.
Yes, Parthiban.
Sir, in the recent times, there is a new talk called artificial intelligence. Will there be any impact of AI in surgery? Will there be a threat to the conventional surgeons?
Yes, Parthiban. That's a great question, Parthiban. Even I'm a great proponent of robotic surgery, actually. Yes, I won't consider it a threat, Parthiban. It will definitely incorporate, but not near future, guys. Not near future. It takes another century at least for 40 or 50, 60 years from down the line. So if a guy who is doing surgery is never going to face that kind of AI issues in the future, a person, a boy or girl who's going to get born after 10 years, when he's going to practice at the end of his 60 years, he might fail, which means around it takes 80 or 90 years to come that time. So don't worry that the AI will be a competitor for surgeons. Even right now, we are doing robotic surgeries. Okay. In robotic surgeries, we as surgeon operate the robot. It's just a slave model. We do the hand movements like this, and the robot reciprocates that in the machine. So it does not have its own mind to do its own thing. So don't assume that in kind of sci-fi movies, the robot starts operating on the patients. Yes, it might come, but it's a very, very, very long period. And even myself or yourself or any of your colleagues who go to take surgery right now after 20 or 30 years, also if you take surgery, you will be at the end of your lifetime of 70 or 80 years, then also this AI won't be any problem to a surgeon. So don't worry, it's never a competitor.
Okay. And one more question we have, Ankna. Sir, I finished my MBBS 3 years ago. I have my own private practice where I'm earning 3 lakhs per month. I know this is a plateau. I'm very much interested in surgery. But when I left my practice and joined for MS General Surgery and post MCS, I wonder how long will it take me to reach the amount I'm earning now? It is a question by Dr. Kadiravan.
Okay. Right now, Kadiravan is doing his MBBS. He wants to take a MS surgery, right?
Yes, sir.
Okay. There are initially few things you have to see about Kadiravan. Obviously, you can't get in 3 lakhs during a post graduation. So just choose your post graduation in an area where you are having your current practice. That will be my first preference, because right now in your area you got a very huge patient base. That's the reason you are earning almost like 3 lakhs per month. My first suggestion would be, if you are interested in general surgery, try to choose an area which is nearby your locality, so that your patient base will keep on growing after even 3 years as well. So once you complete your MS, if you come back to the particular area, it's not something like your patient base is vanished. So you can choose, yes, that 3 years time will be kind of financially crucial for you guys, because in Tamil Nadu also you'll be paid only around 45 to 50. Even if you come to any kind of state colleges, you'll be paid only around 90 to 1 lakh. So any no government or private colleges pays you 3 lakhs per month, which is you are currently earning right now. So, but that 3 years investment will definitely escalate your journey, especially with a huge patient base, will fetch you more than that. That will go exponentially, but you have to face that crucial 3 years period during your MS residency time.
Okay, thank you. And Dr. Hamad Nasim is asking, how is Saptarjung for surgery?
Yeah, it's a great institute, man. Being a person from Southern, how can I say negative about it? So it's a great institute, and you'll get a good hands-on. You'll get a good hands-on. I will tell you there are a few positive points about Southern first. Like it's India's largest, I think, if I'm not wrong, largest OPD patient census. You'll get a humpty number of patients. You can't count. So second, any patients comes to AIMS Delhi for surgery. You get a humpty number of patients from UP, Haryana, Punjab to AIMS Delhi for referral. But AIMS Delhi got a cap in the admissions. So they can't admit patients more than that particular number. So what they do, they invariably send the patient to Safdarjung, which is across the road. So we don't have any cap of admitting the patients. So we have to admit any patient who comes to Safdarjung. So we have in floor beds. We keep the patient on floor. So the patient load is huge. Whenever there's a patient load is huge, your hands-on will be huge. At the same time, your work schedule will be hectic. There's no doubt about it. In first years, we used to hardly go twice or thrice to our home. So work schedule will be hectic. At the same time, we used to operate 12 to 13 emergency laparotomies per day. I never found any other hospital doing the same number in so far my knowledge actually. So the general surgery exposure is huge. So if you want to learn the core surgical aspects and skills, you can definitely take for it. So my opinions are like almost like 6 years outdated right now. So at that time, we only had a handful of residents. We only had 10 to 12 residents. I think the numbers have increased right now to 24 or 26. So there might be some kind of dilution in the exposure you will get, but definitely it's much better.
Okay.
Yeah.
Then Dr. Srinivas Ayappan is asking, hi sir, it's a wonderful session. I'm from Tamil Nadu. Which northwest can choose based? Sorry, it's not clear. Wait just a minute. Dr. J. Jabed is asking, sir, can you please tell about MRCS and FRCS?
Okay. Jay, my knowledge regarding MRCS, FRCS is very, very minimal, Jay, because after completing my MS or during my MS, I encouraged my residents and my colleagues to do this MRCS. And to be frank, right now, more than 60% of people who are writing MRCS have no idea why they're writing MRCS. So that was the disheartening part, because this is what my assumption, I may be wrong as well, because I have never done MRCS, FRCS. After inquiring, I left that option because I didn't think that it's add any value to my motto in the next 5 years, because my intention was not going to abroad or UAE countries. So my intention was clear. So in that perspective, I didn't find anything which is valuable, so that if I died in MRCS, that will add to my curriculum, apart from adding a degree to your name. If you are interested in going to Gulf countries, yes, definitely MRCS gives a good idea. If you're going for abroad, definitely it is recognized. So apart from these two effects, I don't find anything which is very much to be encouraged about.
Dr. Srinivasan Ayappan is asking, which college in North can we choose based on academics, hands-on training, and what about the bonds there?
Ayappan, this is kind of a question. It runs ages to ages, Ayappan. You will never find a best college, Ayappan. You will never find a best college, because every college got its own positives and negative, Ayappan. Be clear, Ayappan, what you want. If you want a good hands-on and good pay scale, good bond, and if you're willing to, no sir, I'm a basically hardcore person, I can invest more amount of time in board. I'm not kind of a thinkative person at all, so I can put all my physical activity in that, so there's no issues for me. So definitely you can go for a best state medical college, whether it's in Safdarjung or UCMS Delhi or SMS Jaipur or BHU Varanasi. There are n number of hospitals. But right now, apart from Delhi, all other Rajasthan and UP are having bond. Just see that happen. Just see that. Preferentially take a college where there is no bond happen, and the pay scale is equal to Delhi, or quite at least around the 70 to 80s. At least if the pace is good, you can go for it happen. but don't expect that you will have a good exposure and you will have a chill life in a residency. That is not possible. So if you ask me, so what are the name of the colleges for a general surgery program, it is better running. Calicut is doing good, SMS Jaipur is doing good, Safdarjung, UCMS, and we have an BHU Varanasi is doing good, K Mumbai, and even MMC is also doing good. So each and every college of the state government college is doing good, Nayapan. So you can go for it. But before selecting the college alone, see what are the bond, what are the financials, everything. Because just take a decision totally. If you ask me right now, even the peripheral aims is also doing good because I am from aims Patna. What even after completing my subject journey, I thought like doing a surgical course in aims is absurd, man, because we used to get so much referral from aims Delhi. So I thought the residents in aims are not learning much. But after going to aims Patna, I realized the residents in aims Patna are learning equally good. So because it's a new institute and the residents are fresh, there's only a 1 or 2 year batch passed, so the exposure is good. So these are a number of colleges. If you want, you can take peripheral aims as well, provided the mentor and the department is good, guys, because there is no bond. The work life exposure is good for you. If it's nearby your state, you can definitely go for it.
He has also asked, do you have some suggestions for those who got middle ranks in NEET PG?
Middle ranks in HPG, I'm not able to get the question, man.
Like for those who got some in the borderline marks in NEET PG, do you have any suggestions for them?
Acha, you want a next to see the line will keep on going, Ayyappan. You do one thing, Ayyappan, just you text me to that Insta one. Okay. So I'll just do a whatever kind of a suggestion list I can provide for you. I'll do that. So the list is very huge actually.
Okay, we have a few more questions there. Dr.
Yes,
Nivedi,
no,
she's asking, sir, should I take DNB in Tamil Nadu, my home state, or MS in Karnataka?
Sorry, DNB in Tamil Nadu?
Or MS in Karnataka?
It hardly matters. Hardly matters, doctor. So just assess the college. Hometown, even Karnataka is not far away from Tamil Nadu, right? So if your college, if you're in same state, if your college provides a better academic course, better hands-on, and everything is good, obviously it's better to take a home-based college. There's no doubt on that. If you see, the option of Karnataka came here just because I think in some aspect it outshines your native college, right? That's the reason the Karnataka came into the picture right now. Otherwise, no one talks about Karnataka here. So if you think the Karnataka college provides a good academic and good pay structure and a good hands-on surgical experience, you can definitely go for it. There's no doubt in that.
Dr. Shiv Kumar M is asking, any idea about good DNB institutes in Delhi?
Delhi,
Yes.
yes, DNB, Gangaram provides a good DNB course there, guys. Gangaram provides a DNB, good DNB course there. You can go for it. And there are a number of courses, man. I'm not able to recall right now because I got few of my friends in Gangaram. That's why I'm telling Gangaram is good. Even Apollo Lucknow also provided DNB course here. See, the one thing I always feel good about DNB courses, the super specialty exposure is great here. So this is what I witnessed here in Apollo Lucknow, because I joined only few months before here. I see the DNB residents here. The surgical exposure is adequate, and they are routinely posted in super specialty department like surgical oncology, gastroenterology, or liver transplant. So they are constantly exposed and they're assisting us at the point of time right now. So I always feel the MS general surgery guy exposed to super specialty and a DNB guy exposed to super specialty, there's a huge difference. I think in this aspect, DNB guys are placed in a higher position when compared to super special exposure because they are always trained with a high perk papers. Yes.
Dr. Reshma Sarah Thomas, her question is, any opinion on scope of pursuing surgery training abroad, like UK via PLAB?
Sorry, I missed a question, man. Sorry.
She's asking your opinion about scope of pursuing surgery training abroad, like United Kingdom via PLAB exam.
Yes, it's a very established course, right? What else you want me to tell? Like it's an already established course. You have an USMLE for UK and US. You have Australia. There are a number of established courses out there. So after completing your MS general surgery, if you want to do any kind of fellowships as well, Even we have something called as international residency programs. After completing MS General Surgery as well, you can opt for it. Apart from that, there is no ifs and buts. You can write PLAB and go for it. You can write USMLE and go for it. So the options are very wide after completing your MBBS. No issues.
Dr. J. Jabed, he's asking, Sir, I gave NEET PG recently. I might get admission for general surgery in a deemed university. Should I go for it since I know I'll get less hands-on training in a deemed university? What's your opinion about that?
What does mean by deemed university, Pratibhan? I'm not able to get it.
Private
private
college.
medical
Private college.
Okay, no issues. What's his name? Doctor name?
Dr. J. Jabed.
Dr. J. There's no doubt, Jay. If you got a course right now, yes, go for it, Jay. So even the private is doing a good job, Jay. So don't get belittled by, sir, I'm getting a private college. My colleagues are doing a government college or institute. My hands-on will less. No issues, Jay. Just go for it. The exposure will be adequate for you in the initial time, but choose which college you want to go. There's some kind of reputation should be there. So, but if you're doing in a private college, I will always encourage you to keep your stand high to get an MCH course. So make sure you have very clear thought process in that, because I hope the schedule will not be so hectic there. So you'll get a good amount of time to read and prepare yourself for MCH. So if you're taking an private colleges for MS General Surgery degree, no doubts you will also shine. Once you take an MCH course, everything will get neutralized, right? No need to worry about this. You will definitely shine.
We still have two more questions.
No issues.
Dr. Nikita Katar, she's asking, SMS Jaipur or KGMC, which one is better?
Sorry, SMS Jaipur or?
KGMC, King's George Medical College, Lucknow.
One sec here. SMS Jaipur or KGMC Lucknow?
Yes, sir.
See, right now I'm in Lucknow, man. KGMC Lucknow got a very good hands-on. The patient load is huge. The same goes for SMS Jaipur. Even I have a good number of friends in SMS Jaipur. They have a good trauma unit and they are good in good work there. So it's comparing apple to apple, man. Like you can't take a decision. So it both are equally good. See, I always find this department very difficult in a residency. Like we always try to choose best. The human nature is that we always want to choose best, but at most of the time we'll forget the fact that whatever we choose is the good option. It doesn't mean we chose a bad option right now. Suppose if I choose KGMU, then you realize that SMS is doing a better in certain aspect. It doesn't mean KGMU is bad. KGM is also equally good. If you choose SMS Jaipur, and if you see that KGM is doing good amount in liver transplant and all, it doesn't mean SMS Jaipur is bad. So whatever the option you choose, it's a good option. So don't regret about it. Both are equally good. You cannot compare a two-state government medical colleges. Say, this is what I always feel, Parthiman, like even if you get a best rank, even if you get a best college, you might end up with getting a worst unit. Even if you get a very, very back rank, if you get a peripheral remote colleges, you might get a good mentor and good unit there. So it every depends on what the life gives you. So don't be very picky about it. Yes, Parthiban.
Then Dr. Mohammed Amran is asking, hello sir, I'm planning to join MS General Surgery in a private college in a remote area. Shall I proceed ahead or should I opt for DNB? What do you suggest? And how can I improve my skills just based on practice after completion?
Okay, he wants to take in a private medical college.
Private medical college in a remote area.
Okay.
Should he opt out or should he opt for DNB?
See, the question is very clear, man. If you're getting a DNB in a reputed institute, just go for it. Just go for it. There's no doubt in that. Because you assess what is the say remote is a very subjective terminology, Parthiman, and the one who asked the question. So remote for me something different, remote for you something different, remote for some other people something different. Okay, so if you ask me if you're getting a DNB in a reputed institute, just go for it. There is no doubt in that. Okay, so if you're getting an MS in a reputed institute, just go for it. There's no much to worry about it.
And final question from my side, sir.
Yes,
apart
please,
from many colleges in South India, why did you opt for Delhi? And how are you managing your personal life and professional life in this hectic field?
We already passed the time, Parthiban. You asked me a very long question at the end of the session. So I hope I'm not boring anyone. Let it be very crisp and clear. So taking a decision to Delhi is quite difficult for initial times. Not difficult for myself. I had a very clear cut thought. I just want to move out of my town, because I had a very great believer that when you go out of your comfort zone, you will learn. So that was my intention. So that's the reason I chose Delhi, because even initially we got fascinated by Delhi. I just want to do in a MAMC Delhi and AIMS Delhi. So then only I came to know there's a college called Sathish who is doing a very good work in general surgery rather than AIMS Delhi and MAMC Delhi. So that's the reason I chose Sathish. So initially it took me some time to convince my parents, to make them understand that whenever the opportunity comes, we should encourage them, we should embrace them actually. So initial days was quite difficult for me to convince them actually. But once I went there, it took 6 months for myself to adjust to the particular environment, to be frank, because the language is new for me, the food is new for me. I was literally having gastroenteritis for at least almost 3 to 4 weeks. My abdomen was completely bloated. Everything was happening to me. But equally, the schedule was hectic. So I always tell, something happens out of your hand, right? Just hold on to it. Just hold on to it. The things will turn to you. So after 6 months, the things getting clear and clear for me. The environment became so conducive for me. At the end of second year, at the end of third year, so apart from learning general surgery skills in Delhi, I learned more than that. I learned how to address people. I learned how to interact. If you learn the cultural differences, you'll be a better human being, Fathiban. If you know what other people are doing, because if you're in a very small circle, you think that is a world for you, right? If you come out of it, what you are doing is normal. It may not be normal to some other people. So this is what I always feel. So that exposure gave me a push that getting out of your comfort zone will definitely encourage you to reach high heights. That's the same reason I took AIMS Patna as well, because the same kind of questions also happens to me from Chennai. You did in Delhi. Why you want to take in Bihar and AIMS Patna New Institute? Why you want to take there? So just go to the new areas, explore the areas. Definitely you will come out with flying colors. There's no doubt in that. I hope that answers your question, Parthiban.
Session.
And you're not audible, Parthiban. You're not audible.
Am I audible now?
Yes, Parthiban, please.
With this, we come to an end of this day's session. And doctors, please note that the e-certificates will be issued to you via email within 10 days. And thank you once again, sir, for joining us. You gave us a wonderful session, and have a pleasant evening, sir. Thank you so much.
Thank you, doctor. Thank you, IMA, for this opportunity. Thank you.
Thank you so much, sir, for sharing the valuable insights. We are more than grateful to everyone present here. We hope to have you again at our platform very soon for your next sessions. So with all your permission, we are signing up the session over here. Can we conclude the session here, sir?
Yes, ma'am.
Okay, sure. Thank you.
Thank you.